thank you so much for booking your physio assessment at Back to Fitness. My name is Charlotte Murray and I am the head physio and clinic founder. I'm going to run through a few of the key bits of information you're going to need to know before your appointment, just so you know what to expect in case you haven't been to physio before. So, for the actual assessment, we will start by chatting through the injury, going through various medical questions and finding out details about how the injury happened and what things are difficult for you. It's useful for this bit if you bring a list with you of any medication that you're taking or if you've had any medical procedures done with the dates. And then after we've done the chatting bit, we go on to what we call the objective examination, which is where we have a look at your injury, perform various tests and then try to figure out what's going on. Now, it might seem obvious, but to assess the area, we need to be able to see it and we need to be able to feel it. So please bear this in mind and wear or bring suitable clothing with you. So for example, if we're looking at a shoulder or a neck problem, then you might want to bring a vest top with you, or if we're looking at a lower limb problem, a pair of shorts are essential, but some people don't have them. So if you don't, wide leg trousers or stretchy trousers that we can roll up to get to the knee, for example. If you're a runner, it's also really useful to bring your trainers with you as well. So then usually when we have done this, we can then give you an idea of what's going on and usually provide some advice as to how best to manage it. We will aim to start treating the problem straight away at that first appointment, and at the end of the session we will provide you with a home exercise program to work on. Now, you will be asked for your consent at every stage and we will make sure that you understand what you're consenting to. You can decline to consent at any stage and we will of course respect that. Now, whilst we are on the topic of consent, there is a form below on the email which we need you to complete before we can treat you, and without it we won't be able to proceed, unfortunately. You'll see it, it's called the patient intake form. There's usually another form as well on there, which is the outcome measure form. Professionally, we need to be able to show that we are making a difference to our patients. So we do this by asking you the same questions at the start of treatment and then a few months in, and then we compare the differences basically. So if you could please complete that as well, that would be fantastic. Now, another question we get is how many sessions is it going to take? Well, as you can appreciate, this is going to vary depending on the individual circumstances. But as a general rule of thumb, you can expect to need between 6 to 10 sessions. Now, that's not a number that I've just plucked out of the air. It's based on my experience doing the job for over 20 years and getting the best outcomes for our patients. So what happens usually is there's a bit of a flurry of activity at the start of the treatment journey where we're working really hard to reduce your pain and the acute symptoms. And this might be the first 4 to 6 sessions, depending on how you respond. After that, the sessions tend to spread out a little bit because we're going to phase 2, which is more the strength and conditioning part of the treatment journey. And appointments sometimes will increase in sort of distance between them from to monthly at that point in time. And it's basically because muscles take time to strengthen and change. You know, they take at least 12 weeks. And every problem that we see requires an element of strength and conditioning training. So if we only see you 3 or 4 times, we are under treating you, we are not doing our job properly, and you will not achieve the successful outcomes that we want you to have. Practical things. So car parking. We have 4 car parking spaces outside the clinic. 2 are directly outside our door and 2 are on the opposite side of the car park outside of Harry Travis. You'll see which they are because they've got bright yellow signs marking them. If English isn't your first language and you need an interpreter, we can help provide that for you, although it will need to be paid for by you. We would strongly recommend though that you do use a professional interpreter instead of a family member or a friend, as they may not be familiar with medical words or phrasing. Next thing, you can request to have a chaperone present. Please let us know before attending the appointment and we can arrange that for you at no extra cost. We might need to change the appointment time though, just to make sure that we can have a chaperone present. Right, this next bit can be a bit complicated. It's about children and it's about consent. The law is quite specific, but in a nutshell, if you are bringing a child for treatment and they are under the age of 16, we may need parental consent in order to assess and treat them. If they are under 13, we will certainly need someone present at every appointment who can give parental consent. Now, who can actually give parental consent is very specific and wordy, so I'm going to simplify it. biological mum needs to attend ideally, as this is the most straightforward option. Other people can give parental consent, but I'm not going to list it all now because it's really complicated. What might surprise you though is grandparents can't give parental consent and step-parents can't give it if they've simply married the biological parent. They would need to have adopted the child or to have signed a parental responsibility agreement or court order. So obviously, everybody's situation is different and families take all different shapes and sizes. So if you're unsure about it, please contact us so we can help to clarify that for you. But here's just a little example of something that can happen. So imagine mum attends the initial assessment and we suggest a treatment plan, which mum consents to. Mum then can't attend the next appointment, so grandma comes. At that next appointment, we decide that we need to do something different. Grandma can't consent to that change in the treatment plan. So mum would need to be contactable by phone in order for us to get consent for the new treatment. Now, 16 and 17-year-olds with capacity are permitted by law to give their own consent, and we won't share confidential information about them with their parents or others unless we have the child's consent. So, to avoid embarrassment, what that means is that if you are a parent of someone of this age, please don't assume you'll be permitted to sit in the physiotherapy session with them. We would need the consent of the patient first. So what we'd normally ask you to do is to sit outside in reception until we've been able to obtain this consent, and then of course you'd be more than welcome to come in. Children under 16 can consent to their own treatment if they are GILIC competent. Otherwise, someone with parental responsibility can consent for them. I know it's all very complex, but we do take consent really seriously, and we would thank you for your cooperation with this. Right, back on to simpler things. So our cancellation policy is 24 hours notice, and we do this so that we can make the appointment available for other people to use. If we get less than 24 hours notice, then unfortunately the appointment is payable in full. Mask wearing is no longer compulsory. We will not be wearing masks. However, if you would prefer to wear one, or you would prefer the physio to wear one as well, please make this known. If someone attends the clinic though, displaying respiratory symptoms such as signs of a cold, we would ask them to wear a mask for infection control purposes. Payment is due when you attend your appointment. We have a card machine for you to pay on, and it accepts Apple Pay, Apple Watches, cards, all that sort of thing. But appointments booked online, slightly different. They're usually payable in full at the time of booking. Now, for half of the week, we use some girls based in Norwich called LiveLink to answer the calls and arrange appointments for you. If you get a call from a Norwich number, it will probably be the LiveLink girls. So they will always leave you a message. If you need to call us back though, ring our number, not the Norwich number. And the number's below, but it's 0800 0751 641. Next thing, insurance. For those of you using insurance companies to pay for the treatment, and if you have an excess on your policy, then this needs paying at the start of treatment in full. If you let us know what the excess is, we can issue you with an invoice for that amount, and then we can settle up. If your employer's paying or you're claiming it back from somewhere else, you need to pay up front, and then we can provide you with a receipt that you can then claim back from your employer. Last bit, directions. The address is at the bottom, and also the what 3 words code is at the bottom, which will get you right to our front door. But basically, if you are coming from Halifax or Soberbridge, you would go through Triangle, and just before the lights in Ripponden, you're going to take a left down the hill and then up as if you're going up Ripponden Bank, which is the B6113. And then when you've got St Bartholomew's Church on the left-hand side of the road, you're going to turn first right onto Millfold Way. You're going to turn first right again into the little industrial area, and you will see a row of stone cottages, and we are the left-hand cottage with the blue door. If you're coming from Rishworth, into Ripponden, past the co-op, through the lights, take a right, up Ripponden Bank, and then same instructions. If you are coming from Barkisland or Greetland or Elland, then you'll probably be coming down Ripponden Bank, past the Fleece pub, down to the bottom of the hill in the dip, and then you're going to turn left. When you've got St Bartholomew's Church on your right, you're going to turn left onto Millfold Way, turn first right, cottages, there we are. So I hope that answers any questions that you might have. Please do get in touch with us if you've any other questions that haven't been addressed in that little spiel that I've just done for you, and we really look forward to seeing you soon. So take care and see you soon at the clinic. Bye.